Hello, Howard Owens, publisher of the Batavian. I am on the line. We have on the line right now Lieutenant Governor Kathy Hochul. She's on a tight schedule, so we're going to welcome her and jump right into this. So, Lieutenant Governor, good to see you. How are you doing today?
I'm doing well, Howard. Good to reconnect with you and my friends who follow you closely because there's a lot of developing news, and I want to thank you for your role in making sure people have the facts as we try to tamper down the fears.
I appreciate that, Kathy. So, one of the things I wanted to get you online to talk to you about is because I know with your time in Congress here and your many visits to Batavia and Genesee County, you've always really been concerned yourself with our community and our small businesses. And, this is definitely impacting our small businesses and the people who work for them. And I just wanted to see what message you might have for them.
Hang in there, because we have anticipated that after this healthcare crisis abates, and it will abate. I don't have a time frame, and individuals who are following the governor's press conferences are getting the most up-to-date information, and I recommend them highly. They're usually in the morning between 10:30, 11 or so. So that's the information he has to deal with the healthcare crisis. But I want to assure everyone that we, in addition to protecting their health, want to protect their livelihoods. And you're absolutely right. I love downtown Batavia and the people who are the hardworking farmers and small business owners. And there's a lot of fear and anxiety out there. I can just feel it. And we are already focused on the recovery. We have an initiative called New York Forward. I'll be very involved in the upstate parts of that because that's where my heart is. That's where I live. And I want people to know that there's money coming through the Small Business Administration. Empire State Development is helping link businesses to direct funding sources. We've suspended the requirement to pay your sales tax. So money you've been collecting throughout the year, you can continue to use. You can pay it, but if you pay it late, there won't be any penalties or interest. Mortgages are protected. So no one's going to be evicted from their homes. We're dealing with credit cards, student loan debt. So we in government are doing everything we can to lift that burden from our residents, many of whom are going to be unemployed, sadly, as well as our small businesses. So I'll be out there fighting to make sure that we can get back to the place we were, which is finally seeing new life brought into places like downtown Batavia, which has just been extraordinary. We don't want to go backwards. We're not going to go backwards.
Well, I appreciate that, Kathy. And just to mention, last several mornings, we're putting the governor's press conference daily briefing on our site live right on the homepage while it's going. And then later in the day, we put up the video that gets posted on YouTube along with the press release that goes with that. And one of the things the governor's been talking about is how well we're doing on testing in New York, that the per capita rate is higher than South Korea and anywhere else in the nation. But what I'm still hearing from our health department officials, and people are posting on social media locally, that they can't get tested, that there's a frustration about the lack of tests. So kind of where are we on testing, and why isn't Genesee County maybe getting the tests that the officials think we need?
Well, it's not just Genesee County. I mean, I've been on the phone with healthcare professionals for upstate New York, and it is a shortage issue. And what we don't want to think is create an expectation that everybody who just wakes up and wants to be tested can be tested. We have to prioritize the limited resources that we have, even in New York City. We have to make sure that healthcare providers who are literally going into facilities, touching patients, that they're tested first to make sure that they don't become the source of spreading. First responders, the people respond to your house if there's a heart problem or even an overdose or something. These people are very exposed. The people who drive the ambulances, the EMT workers, the police, the fire, and as well as people who are home health care aides. I want to see, there's a prioritization of who's being tested. And unfortunately, there are just not enough swabs and the reagents and even the containers that are used to collect this information. So there's not widespread testing available right now. But here's the point to make. We already know that the train has left the station. We know that the majority of New Yorkers probably have been exposed to the coronavirus or already have. I think, as the governor has said, we're going to find out that this has been in our state since January, possibly February. A lot of people will have had it and self-resolved or just had the sniffles or a mild fever or flu that they thought was nothing and got over it. And that's the good news now, because they will have built up antibodies to protect them from someone else. So testing is important to track where we start having hot spots and to deploy our resources there. But anyone watching the news would understand that New York City is under siege right now. The governor saw this coming. We've been ramping up with all of everything at our disposal, ventilators, creating hospital beds, ICUs, and truly what we're learning about what we're doing in New York City can be used if needed, and we pray it's not needed, in upstate communities as well to help contain this. So testing would have been great if everyone could have been a month or month and a half ago. We've been begging for supplies from the federal government. They didn't arrive in any time that would be helpful to us, so we have to prioritize the testing. But here's the best advice. Act as if you have the coronavirus. Self-isolate yourself, as lonely as it is, and it breaks my heart because there are senior citizens who live alone, and the only contact they may have is when a family member visits or their health care aide checks in on them, and now they can't do that. That is heartbreaking to me. But we can save their lives, and that's one point I want to make, and I think if you watch the governor, he made this point yesterday. The number of people being hospitalized, that rate, which was going up exponentially, is starting to not go up at such a fast rate. It's still going up, but that means that the people who've been most vulnerable, our senior citizens particularly, people with underlying health conditions, have been isolated and have not been exposed. That's why we're going to save lives, but people continue to follow these practices, as well as just washing your hands. If you go to a grocery store, take a disinfecting wipe and rub the shopping cart handle with that, and do everything you can to stay away from others in the stores. But testing would be great for everybody. We don't have that capability for everybody in New York State. So let's act as if we have it. Social distancing does not have to mean that you're socially disconnected from people. So stay in touch with each other. Look out for your neighbors. Call senior citizens. Call people you haven't talked to your entire life. And we'll get through this together.
I think that's good advice. So, Kathy, the other thing I wanted to ask you about, I don't know if you had a chance to see this story we published yesterday. We have the Buffalo Federal Detention Facility here, and I realize it's a federal facility, but you and the governor might have contacts that can help out with this. The attorneys there are complaining that the full court docket is going forward, that there are people in the court system there that have tested positive, and they're continuing to push forward. Is there anything you think that the governor or your office can do to deal with this issue and get the immigration court to ramp down how much activity is going on there? And I want to add, Kathy,
this is the first.
I want to add, I think one of the concerns is these are people that, even though they might live elsewhere, they're working here and they're passing through our community, that are in a kind of what may be becoming a hot spot for COVID.
Well, that's certainly an important consideration, and I'm willing to take a look at that and see what can be done to protect our citizens, no doubt about it.
Good. The last question I had for you, Kathy, is one of the things the governor's talked about is we're one state, and that there may be patients brought from downstate into upstate. Would you foresee, patients from downstate coming up to UMMC and into Genesee County?
Well, this is something the governor spoke about before we had the response from FEMA, because the governor had been asking literally for days for FEMA and the Army Corps of Engineers to come in and start building hospitals in New York City. So what the governor is going to do is make sure that we have at least excess bed capacity of 1,000 in each of the boroughs. There's 5 boroughs. We're talking about Manhattan and Queens and Brooklyn and the others, as well as the hot spots on Long Island and the other affected counties of Westchester and Rockland. So that's a new development. He wants all of those communities to have excess bed capacity with the support of the federal government. We're finally getting what we've been asking for. There'll be literally a Navy ship showing up in a couple of weeks that's going to handle excess capacity. So while we're starting to see, I have no way of knowing that direct answer, but we are building the capacity close to where the epicenter is right now. At the same time, making sure that our hospitals are equipped with ventilators, that they're doubling their capacity or at least raising it by 50%. All the hospitals have been on board helping us with that initiative. We've been working hard to get them supplies. They may not have supplies for next week, but the point is, do you have them today? And we're going to continue to building a stockpile. I know hospital administrators would want to make sure they have enough to go last into the future. We're going to just have to manage expectations here and make sure that we can do the very best we can. So I anticipate that people upstate New York will be well taken care of because of these measures we're taking in advance of any major hotspots or clusters forming in upstate. And again, we can avoid that from happening if people follow the social distancing rules. Don't take your kids to a playground right now and get close to other children. Teenagers, don't be out there playing basketball with each other. I'm sorry, but we are called to action here, just like our great grandparents and grandparents were, to be engaged in a war effort. That war effort for my grandmother meant leaving 8 children at home and going and working at a factory to make airplane parts to support them, and family members going off to fight in the battles. Our battle is simply staying home and looking out for each other via technology, calling people, staying connected. That's all we're asked to do. And it is hard for people who are losing their jobs. I understand that. We want to make sure that those unemployment checks flow to them as soon as possible. And I know there's frustration with how long it's taking to get through on the phone lines and the website. If you can just let people know that we have done unbelievable measures, taken unbelievable measures, hiring more people, deploying people from other call centers that aren't being used, like the DMV, to help with our DOL, the Department of Labor calls, hiring more people, just getting them on site to handle. But the good news is, if you are filing and trying to file for your unemployment claims, and there's going to be a lot of them, your benefits will be backdated to the first day you're unemployed. So if it takes you a week or 10 days or whatever to get that filed, don't stress out about it. Know that the money will be retroactive, so you won't lose any money there. And with this federal assistance, we think the state of New York should have gotten a lot more money than we did, to be honest with you, percentage-wise, compared to places like South Dakota. We're getting a very small percentage, considering we are the epicenter of this nation and possibly the world at some point. So we need more money, more resources, but we're going to make sure we get this done. And that's the message I want to leave everyone. We can control this, particularly upstate, where I have to say it is so much easier to isolate yourself, as sad as that, as tough as that word sounds. But most people in our rural communities live in their house by themselves or with their family members. They don't live in a high rise with 1,000 people all using the same elevator. They don't go to parks where you're trying to spread out and you are literally shoulder to shoulder with other people. We've got a lot of open space. We've got people living in homes independent from others in the community. Let's use that as a strategic advantage. Tamper this down now by following these rules, the hand washing, the distancing, and I think that we can keep it from being spread like wildfire upstate, and that is our objective.
Well, I think that's a great message, Kathy, and I want to really thank you for your time. I know you've got other appointments to get to. And I just want to say one thing that I'm seeing on social media, hearing from people, even people, we know there are people up here that don't necessarily like the governor, but I'm hearing even from them, they appreciate the leadership right now coming out of Albany, your office, the governor's office, and I think you're taking the time to talk to our readers about this, demonstrates that, and I really appreciate it.
Thank you, Howard. Stay. Bye-bye.
Bye-bye. You take care.
All right. Thanks, Howard.